So there are a few reports in the literature about patients undergoing cardioversion with a pacemaker or an ICD, and these patients suffered from lead or device damages. And these reports are mostly more than 15 years old and mostly concerning patients with pacemakers undergoing monophasic shocks. But still it seems that physicians today are a bit worried about external cardioversion in patients with pacemakers and ICD. And we actually did a survey last year asking centers in Germany about how they go about cardioversion ICD patients. And we found that only 50% of centers regularly involve internal cardioversion regimen when they do perform cardioversion. And the reason for this was that centers said they were very worried about complications with leads or devices. And we sought to fill this gap in evidence with our study. So the Cologne cardioversion trial was a randomized trial involving 12 centers in Germany, one center in Australia. And we included patients with ICD or CRTD who had atrial fibrillation or atrial tachycardia and were scheduled for cardioversion. What we did was we randomized them to internal cardioversion or external cardioversion, and we looked at efficacy and safety endpoints. So what we found was that in terms of efficacy, external cardioversion was more effective with a 93% conversion rate versus a only 65% conversion rate in the internal cardioversion arm. With regards to safety, we actually saw more events in the internal cardioversion arm in terms of our safety endpoint. And interestingly, we found 3 events of what we termed silent lead malfunction. So these were patients with normal lead values prior to cardioversion, and what we saw was that these patients suffered from lead failure through the shock, and our theory is that these leads were actually not working properly before, and the high voltage shock unmasked this event. So in our practice, we actually changed our regimen for cardioversion in ICD patients because of this, and we regularly involve internal cardioversion in these patients, especially in patients who have not suffered any shocks from their ICD or have not been tested at implantation, just to be sure that these patients do not have silent lead malfunction. And also in terms of external cardioversion, I think we add evidence that this is a safe procedure which can easily be performed by centers.